Surgeons need reliable technology to perform organ transplants. Even before the donor organ arrives at the operating table, it needs to be well supported during transport. After the transplant, various equipment helps physicians to constantly monitor the new organ. Heart transplants are almost a daily event for Kavus Hakim Maibodi because he works in Germany's largest transplant center, the Heart and Diabetes Center North Rhine-Westphalia in Bad Oeynhausen.
Wir haben in diesem Jahr unsere 2000. Herztransplantation durchgeführt.
We conducted our 2000th heart transplant this year. So far, we transplanted almost 2,500 organs at the Heart Center. Those are heart transplants in most cases, but combinations of heart and lung together and lung transplants are also among our specialities.
When ein Organspender zur Verfügung steht, werden wir
When an organ donor is available, Eurotransplant notifies us that there's an organ for our recipient. An organ procurement team then travels to the recipient. An organ procurement team then travels to the donor. This may be within Germany or within Europe. The organ is then examined, and if it's approved for transplant, the organ transport to our clinic begins. Usually the heart is shut down with a special solution and cooled at the same time. Then the organ harvesting surgical procedure is performed. Here you need to ensure that the heart is not damaged and for the connecting vessels to be long enough so the heart can be transplanted. We usually have about 4 hours to transport the organ from one location to another and to supply it with blood again, so the organ does not suffer any permanent damage. For longer distances, the organ care system provides an alternative. This is a transportation system where the heart is supplied with blood during transport with a mini heart-lung machine.
Das ist also das Organtransportsystem, kurz OCS.
This here is the Organ Transport System, abbreviated OCS, which is used to supply the donor heart with donor blood, oxygen and nutrients during the transplant process, and also to avoid the standard method of simply transporting the heart by using ice packs for cooling, which over long distances can lead to the heart being damaged and to poorer results.
Was auf lange Strecken dazu führt, dass das Herz dann Schaden erleiden kann und damit auch die Ergebnisse schlechter werden. Man hat hier eine entsprechende Perfusionskammer.
In this case, the heart is attached to a corresponding perfusion chamber. These tubes are flushed with the respective donor blood. The heart is connected on the top and has a drain on the bottom, which is used to collect the blood on the bottom, and then also to supply this collected blood with oxygen again and reuse it to perfuse the heart.
Und es dann wieder zur Perfusion des Herzens zu benutzen.
This second chamber can be closed off during the transport process and provides the potential for storing and position changes with the sterile film. A secure cover is used for the final transport to prevent the heart from suffering any mechanical damage.
Um zu verhindern, dass das Herz irgendwie mechanisch Schaden leidet. Der entscheidende Vorteil des Geräts ist,
The clear advantage of this device is that compared with typical situations during transport, you can supply the heart with nutrients and oxygen and monitor the heart function during transport. In doing so, the receiving hospital can be sure when it begins the transplant that the available organ also correctly assumes its function.
einwandfrei übernehmen wird.
Sometimes, however, the patient's state of health doesn't permit a long wait for a donor organ. This is when physicians look to alternatives, artificial hearts and mechanical pumps.
Sollte ein Patient kein Organ bekommen,
Should a patient not receive an organ in time, that is to say, there's heart failure that we're not able to contain with drugs, artificial pump systems have to be used. Basically, there are single and biventricular systems and a complete artificial heart where the person's own heart is removed. We focus on technology with centrifugal pumps. These pumps are being inserted into the body. The blood is pumped from the left ventricle into the aorta at high speed. In doing so, the energy supply has to be directed through the skin to the outside. Normally this happens via a cable. Usually, a biventricular system has a pneumatic driver. These systems are usually next to the body, meaning the pump can be outside the body and the pump tubes lead into the body.
Neben dem Körper, also die Pumpkammern liegen außerhalb des Körpers und die Blutschläuche führen dann in den Körper hinein.
And in the case of an artificial heart where your own heart is removed, a pneumatic driver is used. That is to say that although the artificial heart is implanted into the body, the tubes for the compressed air have to be led through the skin into the body, so to speak. After the artificial heart transplant, patients stay at the VAD ward, the intensive care and nursing ward for artificial heart patients. Here they are constantly monitored by hospital staff and various equipment. Monitoring already begins in the operating room where the surgeon implanted the pump and the machine is meant to take over the task of the actual heart function. The cardiovascular perfusionist slowly reduces the heart-lung machine in its function, and we then begin to start up the support system. That is to say, we need the so-called controller as the initial surveillance in the operating room, and in terms of the pump, we need a monitoring facility that enables us to modulate the system, but also at the same time to see how the pump is now taking over the job. Technology is essential with organ transplants. With its help, physicians are able to save lives where nature had already given up.